All right. Well, good morning, everyone. I want to thank you for joining me today. My name is Cara Delgado, and I am the owner of the North Houston Home Instead Senior Care Office. I am also a social worker. I have been working in the field of senior care, healthcare, and really in the population of geriatrics for about 30 years. So it's been a minute or two. I'm happy to be here with you all, and we have a lot to cover, so I'm going to jump in here fairly quickly. I do want to kind of acknowledge that I'm struggling with the person-centered care. So if you hear me saying patient-centered care, that's my 30 years of being in and around the healthcare field. So here we go. As you can see on the slide, there's the title of the presentation. Again, I want to welcome you to the today's webinar. Today we're going to be talking about a topic that is really near and dear to my heart, and that is caring for an individual with Alzheimer's. As I said, this is a topic that really is near and dear to my heart. And so we're going to start by looking at the symptoms, kind of starting with some basics. And while, Alzheimer's and other dementias are not a normal part of aging, they are certainly challenging. And along with the growing number of individuals with Alzheimer's, what we are seeing is more and more of the disease and more people stepping in as family caregivers. And so it's important that families understand Alzheimer's and the symptoms and how they present in their loved ones. Families are going to often turn to the professionals and other family caregivers through support groups. So we're hopefully today we're going to learn a bit about how to handle these symptoms and understand these symptoms a little bit more. I know many of you probably understand the disease, but I want to start by just reviewing some basics, okay? Just so we're all on the same page. And then we'll go into some of the symptoms, how to minimize those symptoms. The symptoms can make the disease very challenging, and we can help families with tips and strategies as they relate to these symptoms. And then we'll talk a bit about person-centered care. Again, you may hear me mess that up and call it patient-centered. I apologize. And this is really an important piece when you're caring for someone. It's important to recognize the person and not just the disease. And keeping the person at the center of care, that can really help families be more successful in providing care. And then finally, we're going to be talking about the importance of caring for ourselves as caregivers. And then we're going to end with some resources. So let's go ahead and jump into the basics here. The term dementia can be confusing because it's used sort of as an umbrella term, and there are multiple types of dementia. We have vascular dementia, Lewy body dementia, Alzheimer's disease, frontal temporal dementia, and people can actually even have a mix of several types of dementia. And families may get confused by these terms, and their loved one may also be diagnosed, just to add more confusion, their loved one may be diagnosed with what we call mild cognitive impairment. And mild cognitive impairment causes cognitive changes, and they're serious enough to be noticed by the individual who's experiencing them. They're also noticeable by others. But the changes are not really severe enough typically to interfere with daily life or independent functioning. And if this is the case, then we want to ensure that our loved one's cognition is tested by a physician, because having a diagnosis of mild cognitive impairment does put the person at higher risk for developing Alzheimer's or some other type of dementia. So we want to keep a close eye on that and recommend that folks get their family member in to see a physician. One of the different types of dementia, Alzheimer's is the most common, and that's the reason why we focus so much on Alzheimer's and why we're focusing on that today. So Alzheimer's disease, again, as I noted, it is the most common type of dementia. Somewhere about 60 to 80% of all dementias are Alzheimer's disease. And the greatest risk factor is age, but it's certainly not a disease of old age. Younger onset, or what we know or call early onset, affects younger people, generally under the age of 65. And up to 5% of the more than 5 million Americans with Alzheimer's disease have that early onset or younger onset. Alzheimer's disease is due to microscopic changes in the brain over time. Research is finding that these changes start long before the first signs of memory loss. In Alzheimer's disease, two abnormal structures called plaques and tangles damage and kill nerve cells in the brain. And plaques are deposits of protein fragments called beta amyloids, and they build up in the spaces between the nerve cells. Tangles are twisted fibers, twisted fibers of another protein called tau, and they build up inside the cells. And through autopsies, studies have shown that most people develop some plaques and tangles as we age. Those with Alzheimer's tend to develop far more and in a particular pattern, and beginning in the areas important to our memory before spreading to other regions of the brain. And Alzheimer's is a progressive disease, which means it worsens over time. And you will hear Alzheimer's described in three general stages. So we have mild Alzheimer's or early stage, moderate Alzheimer's disease or middle stage, and then severe Alzheimer's disease or late stage. And currently there's no cure for Alzheimer's and there's no way to stop the progression. However, there are treatment options for symptoms, and some of the most common medications you may hear about to treat the symptoms are Aricept, Exelon, and Namenda. Non-pharmaceutical interventions are also available, and I will talk a little bit more about that later. And while there is no cure across the globe, there's a lot of work being done, and so there is hope. Researchers are working to uncover many aspects of Alzheimer's and related dementias. And 90% of what we actually know today about the disease of Alzheimer's was discovered in the last 20 years. So there's been some remarkable progress that has shed light on how Alzheimer's affects the brain. The hope is to a better understanding that will lead to more treatments or new treatments. And many potential approaches are currently under investigation worldwide. And much of the research being done focuses not only on what happens in the brain at the cellular level, but also on non-pharmacological interventions that can help those living with the disease and those who are caring for the person with the disease. Okay, so I think it's good to put a little context around this discussion, and many of you have probably heard some of these numbers, but I still think I want to share them because this really is becoming a worldwide issue and a worldwide disease. In the United States, the Alzheimer's Association reports that in 2018, an estimated 5.7 million Americans had some type of dementia. And every 65 seconds, someone develops Alzheimer's. It is the sixth leading cause of death in the United States, and 1 in 3 seniors die of Alzheimer's or another type of dementia. And that number's probably skewed because oftentimes when people die who have dementia, it's generally from a complication like pneumonia. Maybe they've lost their ability to swallow, and so they get food down in their lungs and they die from the pneumonia. And it really depends on how the physician classifies that death. The unsung heroes in this disease are the family caregivers. 18.4 million hours of care are provided every year in the United States, and that accounts for $232 billion dollars. In Canada, there's 740,000 living with dementia at a cost estimated to be about $10.4 billion per year. Worldwide, there are more than 44 million people living with dementia, and every 65 seconds, someone in the world is diagnosed with dementia. There's a great video that I want to encourage you folks to check out. It's by Alzheimer's Disease International, and it's entitled Every 3 Seconds. So you can do a quick search online to watch that if you'd like. So I'm kind of curious, just comment in the chat box. What do you think of these statistics? I found them pretty staggering. So just quick comment in the chat box if you have any thoughts about these statistics. Since dementia involves the eventual loss of memory, cognition, judgment, and the ability to take care of oneself, caring for someone with Alzheimer's or another type of dementia can be extremely demanding and more stressful than caring for someone who is ill but not cognitively impaired. 59% of family caregivers of people with Alzheimer's and other dementias rated their emotional stress as high or very high. In addition, about 40% of 40% of family caregivers report symptoms of depression, and that's compared to the general population of 5 to 17% of non-caregivers. Most of the care is being provided by family caregivers who are devoting an incredible number of hours to the task each week. In addition, many family caregivers are in what you've probably heard of as the sandwich generation. They are caring for older parents, and they may still have children at home, high school, maybe college. The care that they provide affects their entire family's life, their work life, and females are often taking on the majority of the care, about 2/3 of the time. And along with stress, there is a real problem with isolation. So according to Dementia Caregiving in the United States report by the National Alliance for Caregivers, nearly half of dementia caregivers say providing care is emotionally stressful, and 29% indicate physical strain. Dementia caregivers are twice as likely to indicate that their health has worsened. And according to a survey conducted through Home Instead Senior Care, 74% of caregivers report that they have become isolated. And the majority of those surveyed say caring for that loved one is difficult and can be extremely overwhelming. And the main reasons that they cite for feeling the isolation are they leave the house less frequently with their loved one. They feel a reduced quality of life. They say stay home because it's easier than dealing with those unpredictable symptoms. Hopefully today we can help give some tips on how to cope and dealing with some of those challenges and maybe help people feel a little bit more confident in preventing those feelings of isolation. So let's talk about the symptoms of Alzheimer's. So the symptoms of Alzheimer's generally occur over a period of time. The person may have one symptom to start, but then develop more symptoms over time. And we can help to educate families about these symptoms in a way that if their loved one has not yet been diagnosed, the families can use this information to decide, to determine, is it time to get tested and evaluated for the impairment. In many cases, these symptoms would indicate that the individual is in the early stages of the disease. But again, it's important to note that these symptoms usually develop over time. If you're a professional here today and you're working with families, an older adult, or it's just important to understand that the disease does develop and change over time. If you're working with an older adult who starts just immediately out of the blue having these symptoms, experiencing confusion, it's probably a good idea to see a physician, because oftentimes what I see in working with our clients is they have a urinary tract infection or it's a medication issue. According to the Alzheimer's Association, the most common symptoms of the disease include memory loss that disrupts daily life. So you may notice reminder notes. I have to tell you, my father-in-law had notes and lists everywhere. If my memory serves me, he actually had directions on how to get home from different places. You may also see difficulty completing tasks, trouble remembering, how to manage their bills, how to write a check, challenges in planning and problem solving. So trouble following a familiar recipe, confusion with space and place and time. They may forget where they are, how they got there. They may get lost. I'm sure you all have stories about that and have experienced that, some of you. Trouble understanding visual images and spatial relationships. So a hard time judging distance. I can tell you over the years, in my experience, I've had at least 2 clients who were driving, yielding to oncoming traffic to take a left turn, and they misjudged the distance and they got hit on the broadside. So does anyone have any other examples of any of these common symptoms? If so, comment in the chat box. Misplacing things and losing the ability to retrace their steps, another common symptom. Obvious example is losing one's keys and they can't retrace or retrace steps to find them. Decreased or poor judgment. They may start giving out large information to telemarketers over the phone. They may give away large sums of money. Withdrawal from work or social activities. They quit going to bridge club or Bible study or some type of social event because they really don't want others to notice these changes. And then also changes in mood and personality. So they may become more easily upset, depressed, anxious, problems with speaking and writing. So they stop in the middle of a conversation or a sentence. They have trouble with word finding. And we all have a little bit of that, but it's noticeably frequent when we're looking at someone with Alzheimer's. As the disease progresses, there is likely to be more symptoms that will surface and generally will fall into 2 categories. Helping families understand the types of symptoms will be important in providing care. And first, I want to make sure that everyone has noticed I'm using the term symptom and not symptoms and not behaviors. And these 2 terms are used interchangeably in the industry, but there is a trend towards using the word symptoms because Alzheimer's truly is a disease of the brain, and that's causing the person to have these types of cognitive and behavioral symptoms. Sometimes this can be hard for families to understand and grasp, especially if mom or dad has always been fairly mild manner and then now they get easily agitated or angry. If we can explain and understand, it's a disease of the brain and give people tools to minimize these symptoms, we can help them, go a long way in becoming more successful caregivers. When talking about the symptoms, it's helpful to think about them into 2 categories, cognitive and behavioral symptoms. You can see on this slide a few examples. And so when we're talking about cognitive symptoms, sometimes it helps to use an analogy. I heard from Erin Benito. She is an Alzheimer's and dementia expert, nationally known, does lots of training and talks. And she kind of referred to this, it helped me think about it in this way. The brain has little pieces of information. It's like information on a sticky note, and that gets stuck into our long-term memory on that sticky note, new information. But when the disease of Alzheimer's or dementia enters the brain, the sticky notes lose their stickiness, and that information never gets transferred or saved in long-term memory. And so I thought I'd share that. I thought that was pretty interesting way to think about it. So when we talk with families or about the behavioral symptoms of Alzheimer's, we need to recognize that the behavioral symptoms are usually presenting due to an unmet need of some sort. So that's important. I want to say that again. We remember to recognize that the behavioral symptoms are usually due to some sort of unmet need. So we can talk about some common unmet needs, and we're going to do that in just a little bit. But before that, I want to touch on the severity of those behavioral symptoms. Some of these symptoms can put the person or another person's safety at risk. Some of these symptoms are just annoying and frustrating for the family caregivers or the people around them. So I like to use a chart on the next slide to illustrate and really put this into perspective for y'all today. All right, the following chart, or this chart, provides a general ranking of these symptoms in terms of frustration, difficulty, or danger or harmfulness. This can be helpful at various stages of the disease, but especially when a person is diagnosed with the disease. A lot of times there is a fear of unknown and a fear of symptoms. So if we can break that down into a fairly easily understood chart, I think that's really helpful, and families can better cope and anticipate these potential symptoms, and it can even open up some conversation. So if we look closer at this chart, some symptoms, as I said earlier, can be frustrating to deal with, like repetition. When someone repeats the same question over and over and over, that can be frustrating. So, for example, we had a caregiver who was frustrated because the client kept asking her, when is it time for lunch? When is it lunch? And it was just over and over and over. The caregiver, we tried to brainstorm with her and give her some ideas. So we encouraged her to do a couple of things. First thing, just point to a clock and remind the client that when the little hand's on 12, that's when it's time for lunch. The next time, we encouraged her to give them a choice, or to say something like, it's not quite time for lunch. How about a snack? So you can give them a choice. Or you might say something like, it's not quite time. Soon we'll be eating lunch, but first we have to get cleaned up. And this can kind of help you maybe get a shower done for the day. You can also use this as an opportunity to start a conversation. Ask them if they can remember a favorite meal, or that their mom or grandmother prepared for them when they were a child. Again, it's important to identify the severity of the symptom, and that can kind of help us understand, is this something that needs immediate attention? So symptoms that are harmful and fall on that right side of the chart, maybe things like wandering, that's going to require some immediate action. So again, the chart is about putting the symptoms into perspective and determining what type of action is really required in that moment. And so, as I mentioned earlier, there are a lot of times these symptoms are when the person has an unmet need and they're trying to tell us something. So we need to really tune in as family caregivers into their needs and maybe kind of put on our investigative hats. But let's look a little bit closer at some quick checks families can do on the next slide. As the disease progresses, the person with Alzheimer's will likely have difficulty telling us about their needs, right? And so instead, symptoms may present. And again, we have to tune into those symptoms, put on our detective hats, and really try to uncover what their unmet need is. And we can break these needs into 4 categories as shown on the slide: emotional, social, physical, environmental. So I'll give you a few examples. If your loved one is pacing back and forth, the person's probably trying to tell you something, like maybe they need to go to the restroom, and they just can't find it, or they can't express that physical need. At a family gathering, you may have your loved one get agitated. That's going to be probably an environmental need. It may be overwhelming. There's too many people. It's noisy. So, taking the person into a quieter space and having family members visit one-on-one, should help the situation. Or perhaps they keep asking to go home. I'm sure, comment in the chat box if you've had this happen. If they're asking to go home, it's probably because they feel unsafe, and home is often seen as a comforting place. Now, in their mind, home may be their childhood home. So telling them they're already home is probably not going to be very helpful. Telling them that you're there, that they're safe, and offering some sort of physical touch of reassurance, maybe holding their hand, rubbing their back, something like that can really provide a sense of security in that moment. So as you can see, the chart's important in understanding and recognizing unmet needs. When this is understood, it can really lead to being a more confident caregiver or more confident caregiving, and hopefully it can lead to more good days. So let's talk a little bit about the person's needs on this next slide. We call this person-centered care. All right. Person-centered care is an approach that's really becoming the gold standard in Alzheimer's and dementia care. Person-centered care has been it's been researched and studies have actually shown that it can reduce agitation and aggression in people with dementia. Other studies have shown that it significantly reduces the number of hospitalizations for people with dementia and reduces the need for antipsychotic medications. The Alzheimer's Association came out with these updated dementia care practice recommendations. So I'm going to encourage you to check that out with them at the end of this when we're talking about resources. They have guidelines that are geared towards professionals, but they also have recommendations from people living with the disease. So I want to share today. I want to share those today, and so that we can help families work with this. And I think the great thing about person-centered care is that families often have the tools and the information that they really need to provide the person-centered care, because they know their loved one. They already have a ton of information about the person. All right, so the person-centered care involves getting to know the person. Again, family members are going to be the best at that. Maximizing independence and practicing patience and compassion. Also, personalizing care to meet the individual's needs and preferences. And then adjusting care approaches to reflect day-to-day needs and abilities. Person-centered care also involves providing ongoing opportunities for engagement that has meaning and purpose, and we'll talk a little bit more about that in just a bit. Ensuring coordination among others who also may provide care. And then it also involves creating a safe and supportive environment that reflects the person's characteristics, personalities, and preferences. And while we can use person-centered care to tailor the care of the individual, we also can, I also have some techniques that families can try in combination with person-centered care. In all situations, trying to remain patient, calm, and empathetic is really important. If we get worked up, they're going to pick up on that energy, and it's really only going to make the situation worse. So again, it's important to stay calm. It's important to remember that the person's brain is failing, and they cannot always help how the symptoms present themselves. So the first tip is to step into their reality. If they think that they are 22 years old and working on a farm, that's okay. It's not dangerous, it's not harmful. It may actually even work to your advantage. So, hey, Dad, you've been working out in the fields and the farm all day. It's time to get washed up before supper. Okay. Try not to take it personally if your loved one says or does something offensive. Don't argue with them or try to correct them. That's not going to get you very far. Compliments can go a long way in making the person feel comfortable, encouraged, and then maintain dignity, or maintain their dignity and respect. Treat your loved one as an adult. Avoid trying to embarrass them. So if they spill something on themselves, you can take responsibility for that and say something like, I'm so sorry I spilled a little bit on your shirt. Let's go get you changed. Match the behavior. If they are gesturing to something, it can be helpful to repeat the gesture and ask for more information. For example, if they're point at the object as well and say, can you show me that over there? Set them up for success by providing simple instructions, one step at a time. Let me think. Yep, next slide, please. So one step at a time. And it's important to remember the symptoms will be different for everyone. Someone may have symptoms that another person does not. I don't know if you've ever heard the expression, if you've seen one person with dementia, you've seen one person. And dementia affects the way a person thinks, feels, and behaves. And some of these behaviors they're hard for family members because they're uncharacteristic and maybe even odd. Okay, so apologize, redirect attention, remove the person or an item from the environment. We're going to talk more about each of these in just a bit. Using memories or activities that you know they enjoy and offer choices and redirect attention is really one of the most powerful tools and tips and helpful. So for example, instead of saying, do you want to eat lunch? You can give the person a choice. Would you like a sandwich or soup today? Showing them the choices is also helpful too. I think with my father-in-law, if he can see what his choices are, it makes it a little bit easier for him to make a decision. You can also do things like in terms of giving choices. Would you like to wear the blue shirt today or the green shirt today? So this can help them maintain some sense of independence, but limiting to the choices can also help them from feeling overwhelmed or from getting agitated and confused. Give them time to respond. Again, patience. Wait 7 or 8 seconds. They may really just need time to process what it is you're trying to say. When a person is upset, sometimes the best thing we can do is apologize, even if it's not something that's really our fault. So for example, if your loved one is wandering around and looking for something and getting upset, you can say something like, I'm sorry, I must have misplaced that. Let's look together. And while you're looking, you can use a simple redirection technique. So, for example, if your mom's looking for her purse, and we've had several clients over the years that have lost their purses. If they're looking for their purse, and they're in the hallway, and there is a photo on a table or something, ask them about the photo. Ask them about the person in the photo, or where did this take place? Can you tell me about that place? By doing that, they may very likely forget what they're looking for altogether. Redirection, that, as I said earlier, can be a great technique. The person's life story and hobbies can help you find information to provide comfort, redirect them to activities and topics that you know they enjoy and like. That is really where person-centered care comes into play. If there is an item in an environment that's bothersome, so remove it. Or remove the person from the environment. So an example might be a television and background noise, turn it off. If there's some sort of activity going on outside, maybe in a neighbor's yard and it's distracting, or they're feeling threatened in some way, your loved one, close the blinds, remove them, take them to another room and away from that window. So again, kind of redirecting, moving to a different environment. You can use what is also known best or known about the person in all of those 3 techniques. So sometimes it takes multiple techniques. So don't give up on the first try or after the first try. We like to say try 3 times, 3 different ways, and that generally will help minimize the symptoms. It's important to remember that every day's a different day. What works one day may not work the next day. Respond to the behavioral symptom quickly, within 30 seconds if possible, of 30 seconds of noticing the behavioral symptom, and that can help really minimize the symptoms. If you think the behavioral symptom is a result of some sort of pain or discomfort, consult with your doctor or your loved one's doctor. So when we direct activities, we want to be sure that they're meaningful. Okay, so let's talk a little bit more about that. All right, 3 types of activities, or there are 3 categories really that activities generally fall into, and that's physical, walking, for example, going to the museum when we can get out and go to museums again, mental activities, so organizing, sorting, doing a puzzle, social activities, that is the 3rd category or type of activity. So that getting together with loved ones, relatives, going to a park, watching some sort of activity together, and use techniques to encourage engagement. So again, you want the activity to be as meaningful as possible. So start the activity on your own. So if you have clothes to fold, start that activity, put them in front of your loved one, and generally they'll probably join in. Give instructions, simple instructions. Simplify the task. So if you know your loved one, your mom, dad, loved gardening, that may be a difficult activity, but try getting some small pots and some soil, some plants, and set up in the garage or maybe on a covered patio, something like that. So simplify a task and activity. Ask for help. So using the example of laundry again and folding laundry, put it in front of the individual and ask them to help you. And oftentimes they will join in. All right, so personalize the activity based on what you know about the person's life. And this, again, is really the person-centered care. So if your dad was a banker and you have a piggy bank, ask him to help you sort the coins. Try to engage all 5 of the senses. So try to engage sight, sound, smell, taste, touch. Okay, and next slide. Don't overthink it. Keep the task simple as you're turning these tasks into activities. Okay, so it's important for caregivers to be proactive as you're thinking about tasks and activities and planning the day out. So again, be proactive. Just talking through issues with a family, that can naturally bring up sort of a question of what could we have done differently. And so, again, being proactive in planning and can be very helpful. So plan ahead, don't overschedule. Create structure and routine. Be sensitive to what times of the day is your loved one more alert or more tired. And then keep a journal with some key information on patterns that you might identify. That can be helpful for other folks who are helping in the caregiving, other family members maybe. And look for ways to help the individual maintain control in their life. Okay. It's important for us and family caregivers to stay well. Okay, so we're going to talk a little bit about how do we take care of ourselves and focus a little bit on our own well-being. We've all heard the term or the phrase, knowledge is power. Learn about the disease, educate yourself on the disease, manage your emotions, and maybe seek help, talk to somebody, seek counseling, join a support group. You can utilize social networks. There's a lot online these days, and we'll talk a little bit about that. Ask for help. Take a break, get some, what we call in the industry, respite care. Again, maintaining our health or your health as a caregiver is really important. I have seen some pretty sad situations over the time that I've worked in the industry where the caregiver actually passes before the care recipient because of stress and strain. Okay, getting plenty of rest, eat nutritious meals, try to exercise, keep up with your own medical appointments, use relaxation techniques, and again, take time for yourself. Maybe try to have coffee with a friend or plan a Zoom meeting and have coffee over Zoom. Take time for your kids, your grandkids. We're doing lots of Zoom meetings with our grandbaby. Go for a walk, take a nap, read a book. Just something to try to take care of yourselves. This is a very emotional journey for family caregivers, and we can help families deal with these emotions. You may, if you're a healthcare professional or a professional on here, you may have family caregivers who want to be a caregiver and they won't ask for help. Or you may have someone a caregiver who doesn't want to do it full time. We may know caregivers or have someone we're working with who wants to control it all. Well, we all know that does not work well with Alzheimer's. So let's talk through a few points and ideas that I think can really help family caregivers in their role with Alzheimer's disease. It affects the core mental functions of a person, and so providing care will not always be easy. And one of the most crucial things we can do to help family caregivers understand is this, that they are going to have to change to be successful in their role. For example, when a person with Alzheimer's disease is talking about their mother and that their mother is deceased, our role as caregivers, or your role as caregiver, is to validate their feelings rather than bringing them back to reality about their mother. By being in their moment, caregivers are going to have a better time of it and a better opportunity for successful caregiving. We also have to make sure that family caregivers understand that caring for someone with Alzheimer's disease is doable. It can be done. It has been done by many families. So you're not alone, we're not alone. The key is to find support from others who are in the same boat, basically. So remember, for Alzheimer's Facebook page, that's a great example. Also remember that one size does not fit all. So it's that's the hard thing about this role, that one idea may work for one caregiver, but it doesn't work for another. So it's a good idea, really, truly, it's a great idea to have lots of information and lots of tools in your pocket. The best thing we can do for each other, as professionals or just as family, caregivers, is to empower the caregiver with tools and resources to be more confident in the care that they're providing, and let them know that there's other ways to get involved. They can become advocates through organizations like the Alzheimer's Association, Us Against Alzheimer's. You can get involved in a clinical trial. Hang on one second here. Got something on my screen. You can get involved in a clinical trial. So again, I mentioned resources. So let's take a look at some additional resources. All right, Confidence to Care. So this is a great book. It's a great resource for family caregivers that are providing care at home for someone with Alzheimer's or another type of dementia. You can learn more by going to the website, www.confidencetocare.com. There's also an app. So on the next slide, there's a great app out there. It's Alzheimer's and Other Dementias, the Daily Companion. And you can access all kinds of tips and resources. It's kind of an extension of the book. But again, tips in dealing with Alzheimer's and other dementias and all kinds of situations that you might encounter. There's a 24-hour caregiving assistance available through a hotline. I'm going to go ahead and give you that number. And Catherine, if you want to type it in the chat, it's 888-772-1487. Again, 888-772-1487. So that's a toll-free number. You can also email questions. And again, just access all kinds of caregiver resources. There are actually some caregivers on there who are sharing their advice and their experience. And so what I like about this is that it's the ability to access tips and solutions on the go. Okay. All right. And then on the final slide, we have some additional resources. So help for Alzheimer's families.com. Great resource. There is free family education series there, live chats with experts every month. There's also an application for dementia respite care, a grant application. If you haven't purchased this book, The Best Friends Approach to Dementia Care by David Truxell and Virginia Bell. David's a well-known expert in this field, and he actually helped us, the Home Instead Network, develop our Alzheimer's training for our caregivers. I mentioned rememberforalzheimersfamilies.com, caregiverstress.com, another great site for tips, videos, just all kinds of advice. The Alzheimer's Association. Definitely check out their website at alz.org. They have a 24-hour hotline or helpline. That 800 number is there on the screen. And I think I would really encourage you to check out the dementia care practice recommendations that they've come up with around the patient centered care. That's some great information. There's also the Association for Frontal Temporal Degeneration, and the website is listed there. Lewy Body Dementia Association. Okay. So another thing I want to mention is early detection. I know that these are hard topics to approach with our families. It's important to get screened. Early detection really can be key in helping to plan and in just navigating this disease. So the good news is that many seniors and baby boomers are on Medicare or will be soon. And Medicare does offer coverage for an annual wellness visit that includes a cognitive assessment. So you might start talking with families about that or your loved one. About getting tested and asking questions of your doctor and just knowing the signs and kind of getting a baseline test of the person's cognitive status. Okay. Any questions? I just want to, say thank you again for joining me today. I'm open to questions at this point. All right.
We're going to switch back to us, and I'm going to just go ahead and let's see what we have. We didn't have a whole lot of questions in the chat, but if anybody has any other questions, please go ahead and put those in now, and we'll get to you. So, Allison, it's not really a question, but maybe you can help her with this. She says, it's very confusing taking care of my mom. One part of my mind is trying to anticipate what she will screw up on next. One part of my mind is trying to schedule doctor's appointments, and another part is trying to figure out how to pay for the right care for her. Yeah. Then she'll throw in a zinger of having terribly infected feet that need a doctor visit stat. I feel like I'm on a roller coaster.
Yeah. I think that's a pretty common feeling. I think trying to keep things simple. I know what can be helpful is just take it a day at a time. And maybe, is there anybody you can ask for help? Is there anyone, often we recommend that families look at, taking on certain roles. So if you've got a nurse in the family, maybe the nurse can help with the doctor's appointments. If you've got somebody who maybe is a little bit more financially savvy, have them help with the bills, things like that. If you really don't have, a lot of family member support that you can divide those roles, you just have to take it one day at a time and deal with what you have right there in front of you. It's not easy. It's a tough job being a full-time caregiver. So I hope that helps a little bit.
Yeah. Can I add something, Cora?
Sure.
I would like to also add, reach out to Care Partners. They're doing some amazing programs to help you during the day with care for your loved one. They can't do the gatherings in person anymore, but they're doing them virtually. So they're bringing the gathering into your home. So reach out to Care Partners.
Yeah. And Catherine, just to kind of reiterate that or caveat onto that, there are a lot of resources, and right now we're all kind of at home. And so, checking these things out online. I know there are Zoom support groups and things that people can join. And reach out for help. And I think that is hard for many of us. It's not easy for us to ask for help, but for Allison, please try to find a way to reach out for help.
Yes, it sounds like you definitely need some. She also wrote, Mom found weird ways to go from one familiar place to another that took her through industrial refinery areas. Worse, she would follow dump trucks to job sites and ask what they were building there. So she would follow the dump trucks. Yeah.
That sort of brings up the ever challenging issue of how do you manage driving when it's maybe not safe. And I've had clients over the years that have gotten in a car and driven and gotten lost, and the family gets a call in the middle of the night, hey, your mom's in Sharpstown. That actually happened. And so there's some tips on how to deal with that, the driving issue, but it is something that you really need to kind of do some research and get comfortable with, because at some point you're going to have that conversation. It sounds like, with her following other vehicles, that could be dangerous. So
very. Yeah. Allison also said your techniques for minimizing the behavioral symptoms are really good.
Yeah.
It says, I found it helpful to redirect their attention to something neutral, non-threatening. I use it when she's starting to get agitated.
Yeah. And when I think about those techniques, it reminds me of a client who we were doing care for at one point 24 hours a day. And at about 10 or so every evening, she would go to the door and she'd say, I have to go to work. I have to go to work. And so our caregivers were having to deal with that. And she had a little table at her entryway with lots of pictures on it. And so, the caregivers would just grab a picture and say, who is this? Oh, it's your daughter. Can you tell me about her? What's her name? And just redirect. Mm-hmm. And then oftentimes they would say, and it didn't always work, but sometimes they would just say, it's not time to go to work yet, Mrs. So-and-so, it's time to go to bed. And they would just redirect her back to bed. But that's the challenge of this disease and these techniques, that what works one day may not work the next. And that's the whole try 3 times, 3 different techniques, and be patient. I can't stress enough, that's the most important quality of being a family caregiver or a professional caregiver, is patience. Very important.
And the patient comes to those who get help.
Yeah.
So good news, Allison said she stopped her from driving a year ago. Yay, Allison, good.
It's a tough conversation to have. It strikes at the core of their independence, taking that car away or the keys away. It's tough, but I've talked with families that they live out of town, and that happens all the time in our society, where the adult children are out of state and they get a call from the neighbor, your mom took my mailbox out, with their car, and that's a real obvious sign that it's time to deal with the driving. But sometimes it's a little less clear, and so a lot of the sites that I mentioned, caregiverstress.com, the Alzheimer's Association, they all have tips for how to deal with that driving conversation. So
yes. And Tara, I don't know, did we put your slides up on as a download for them?
I don't know, because you did that for me.
Would it be okay for that?
Yeah, absolutely.
Okay. So yeah. I will make sure those slides, if they're not already up on this site, they'll be up this afternoon when the replay goes up. So you'll be able to download Kara's slides to get all those valuable phone numbers and all that she had in the presentation.
Yeah.
Tanya said, thank you very much. I have learned and enjoyed this webinar. Well done. Thanks again.
Thank you. Thank you. I enjoyed it. Have a great day, and everybody be safe.
It looks like we're about at the end. So Richard says thanks, and I say thanks again to you. We appreciate you coming on here and sharing your expertise and your knowledge.
Thank you, Catherine. Have a good day.
Thanks,
Bye-bye.
everybody.